Welcome to the Redox Doc video class series. My name is Dr. Ward, and this class is going to be talking about acne as an oxidative stress condition. So let me give you a little background on acne, and that sets the stage for the cellular solutions that we'll discuss. Acne is a skin condition that involves the pilosebaceous follicles. So this is the surface of our skin, and here's a little channel, a little canal that connects to a sebaceous gland. So the gland produces something called sebum. It's an oily substance that travels out this little canal and is on the skin surface. So the parts of our body that we normally associate with acne are the parts of our body that we have an oily sensation: our face, our chest, and our upper back. And it's interesting, there are none of these little glands on our palms or our soles of our feet. You'll never have acne on your palms or your soles. So that's a good thing. But all kidding aside, this system works pretty well to keep our skin moisturized and from drying out, which are some parts of our body are vulnerable to this. But there are 4 factors that activate the problem of acne. The first problem is the excess sebum that is produced when our hormones stimulate the skin. So as we go through adolescence, our hormones activate these little glands and we produce extra sebaceous material. The second part is an outlet obstruction. So at the surface of our skin is where we have keratocytes. There's the keratin containing little thin skin cells that get dry and flake off, okay? But sometimes those skin cells will gather near this pore, and if there's some dirt that gets attached to this oily substance, that kind of gloms onto those skin cells and it creates a little plug, and that will form a little blackhead or whitehead accordingly. So the skin itself creates an outlet obstruction, okay? The next problem is there can be bacteria that gather here, and once this is open to the outside environment, bad germs can sometimes colonize this little area of this gland and cause an infection. And then lastly, when things go really bad and this thing gets inflamed and swollen and kind of breaks apart, this thing will get so large like this, and sebum starts to leak into the tissues around this little beat up gland, and inflammation begins from the leakage of the sebum. It's like a toxic substance inside. And so that skin gets really red and inflamed, and that causes all kinds of trouble too. So most of the solutions, the medical solutions, revolve around a few things. The first would be to unplug this pore. And so there's a lot of skin preparations that dry the surface of the skin, help those skin flake off, and allows this oil to keep flowing nicely. Some other products that include retinoic acid actually improve the health of the skin and help block this sebum production a little bit, and those are fine. And the trouble is that you just can't always get ahead of this thing. And the inflammation that ensues is really a problem. So researchers have been looking at kind of getting to the core of the problem. And so I've got a couple of journal articles that I found on the subject of looking at acne from an oxidative stress standpoint, getting down to the cellular level. So the Journal of European Academy of Dermatology back in 2009 did a study on about 30 patients that they had acne patients and normal patients. And they looked at the levels of catalase and superoxide dismutase in their bloodstream. And they found out that acne patients had a very low level in that group. So there was a breakdown in the antioxidant defense system. And they theorized that one way to track the success of treatment would be to do a blood test and see if these antioxidants were all depleted. And that would cue you in that you've got to get busy treating this patient because they're getting ready to have a breakdown. So another study looked at, it was in the Journal of Clinical Laboratory Analysis. They looked at 50 acne patients and 50 control patients. And once again, superoxide dismutase and glutathione both were very low in these patients. So What's the message here? Well, there's a defect in the tissue antioxidant levels. And if we are trying to think about, well, what could we do? Because this is requiring prescriptions and lots of money. Sometimes these acne treatments are very expensive. And some of these drugs that we give to patients like Accutane can cause birth defects if you happen to become pregnant while you're taking them. Very, very, very sad. So these treatments sometimes are dangerous, frankly. So what could we do for ourselves? It doesn't require a prescription or a doctor. What can we do to improve our cellular levels of antioxidants? And we can restore antioxidant function and our levels by improving our redox potential. So a redox potential is essentially a reflection of cellular balance. The redox molecules in our cells have to be in balance. And if they are out of balance for a long period of time, cells stop working. The imbalance is related to stress that those cells might be under or inflammation that they might be experiencing. So we know that glutathione is produced inside the nucleus of our cells when we have a good redox potential. And glutathione's efficiency of doing its work of detoxifying the cells improves dramatically with abundant levels of redox molecules when they are in balance. So at a practical level, what can we do to improve our redox potential? Yes, our diet is critical, hydration is critical, exercising is critical. But here's the funny thing. Our skin cells on our face have lots of blood supply, lots of oxygen, rich, if you ever cut your face, you realize it just bleeds like crazy compared to your hand. Rich in blood vessels, but yet it's under the attack of the sebum that's getting stuck. So if we can improve our redox potential, we can deliver these antioxidants right to where it needs to be. And they'll be produced in those cells because there's plenty of circulation there. So better than anywhere else in our body, we can have a significant shift in our redox potential by either applying redox molecules to the surface of our skin or taking them internally. And by far and away, the best way to supplement redox molecules for our face is to apply them directly to the skin because they'll be absorbed easily because of that rich blood supply. And so when we apply those, we absolutely upregulate the production of glutathione and give antioxidants like glutathione the resources in these little molecules they need to have to neutralize toxins and free radicals and reduce oxidative stress. So I hope that's helped you kind of see what we can do. When we supplement our body with redox molecules, it's like we kind of step back in time. And as we age, we know from studies that have been done at the Mayo Clinic where they actually did muscle biopsies on people as they at different ages every decade from 20 on out to 90. And the number of the number of mitochondria in each muscle cell declines about 10% per decade. That's what they discovered. Well, the mitochondria are where we make our redox molecules. In the production of our energy, ATP from food, our mitochondria create these redox molecules in an abundant way. If you don't have as many as you age, or there's some imbalance from disease, that's not going to happen as well. So supplementing provides a great resource to help restore that balance, and it happens immediately. So as our skin goes through a 28-day cycle of restoring itself and repairing itself, it's about how long it takes to turn over a full layer of our skin on our face. We can see shifts dramatically in that shorter period of time. Okay, so I hope that's helped you understand the problems of acne and the solutions that we can find at our cellular levels. See you at our next class.